first and foremost, allow me to register my sincere thanks to all ECSA Health Community member states who participated fully in some of the events that we co-hosted, but also together with other partners, UN agencies, bilateral and multilateral, and other regional bodies who are part of our events. Remember, September is an important year for ECSA. We usually celebrate our birthday. So this was the 51st birthday of ECSA Health Community. So we were very happy to be hosting a number of events in New York on the sideline of United Nations General Assembly at 80. And in these years, UN General Assembly, we were very much delighted to co-host two activities. The first one was in 22nd of September, where we had the partner organization named Access Challenge. We co-hosted event titled The Tipping Point for the new global health leadership in Africa. And this event, we were actually trying to see how the African leadership can step up in addressing a number of the challenges that surrounds the health of the African population, from the health diplomacy to the evaluation of ongoing implementation of interventions, up to the engagement of different stakeholders within the continent, Global South, and the Global South and Global North. That was one of the events that was actually concluded very successfully, and the people actually gave us a feedback that it was one of its kind. The second one was on 24th, which we co-hosted with the Muhimbili University of Health and Allied Sciences, together with all the member states, because ECSA, an intergovernmental organization, we also took advantage of having all our member states be part of the organizing committee. But that one was also co-hosted with some other partners with whom we have been working with very close for years. And under this event, it was under the sciencey diplomacy, advancing the global health for the UN Pact of the future. You know, after Sustainable Development Goals deadline on 2030, we shall be having UN Pact for the future. So we wanted to prepare the member states, the regional community, and the global health community on how do we prepare ourselves in prioritizing science, especially in providing health services, nutrition services, and social welfare services. As the post-SD era, we envision it to be more of evidence-based policy formulation, implementation, and we envision it is going to be something that is be using artificial intelligence in solving all the medical challenges, nutritional challenges, and social welfare challenges. And this event was actually hosted at the UN headquarters, so it was one of its very kind. And for us, it was the first time to have a similar arrangement or hosting at the UN headquarters. So that also brought us a very special feeling to us, and the turn-up was very good. People came up for this event, both physically and online, and we had an opportunity to have the Minister of Foreign Affairs for Tanzania, Ambassador Thabit Kombo, who actually officiated and also chaired that session. So among other things, we were able to discuss how Africa can step up and becomes one of the contributors to the science rather than being a beneficiary. That was one. But secondly, how do we as Africans invest on coming up with institutions, both national and regional institutions, that is going to be fostering science in the region and beyond. So for ECSA Health Community, we have a plot that we were given by the government of United Republic of Tanzania in Ngaramtoni in Arusha. So we were communicating a message to our partners that we will be starting developing that plot by establishing the Center of Excellence for Science, Research and Innovation. And that idea was very much welcomed, and a number of partners pledged to support it, so that coming next year we should be able to see how much development has been made in that particular area. Then that was followed with our participation. That was on 25th of September when we attended the high-level UN meeting on control and prevention of non-communicable diseases and mental health. This was the fourth meeting on the subject matter, and that highlights the importance of the member states from ECSA Health Community to prioritize non-communicable diseases, as it claims close to 37% of the people annually due to non-communicable diseases. But the mental health is also becoming a huge challenge. 1 in every 7 people are suffering from mental health disorder. So in that discussion, there were a number of resolutions that came out, and ECSA Community is very happy to be implementing those resolutions, so that to help its member states and beyond to get rid or to reduce the non-communicable diseases and mental health disease conditions. So that was on 25th. Last but not least, it was on 26th, where we were invited as part of the panelists with VillageReach and Youterus. We were trying to discuss issues around the uterus and the gynecological health. In this area, we actually tried to amplify the importance of paying attention to gynecological and uterus health. As of now, women who are aged 50 years and above, 80% of them are suffering from fibroids, while women of reproductive age, about 18% to 30% are experiencing heavy menses. And women who actually close to 10% are suffering from endometriosis. And that makes women actually crying in silence, women dying in silence, because these disease conditions are not given due attention. So in that panel discussion, we were trying to look into strategies, how best we can make these disease conditions around gynecological and uterine health, they should be given attention by the member states, so that in end we can have women with good health, not only for maternal, newborn and childbirth, but the good health for women in totality. And that is what we call the whole of women health, meaning that from obstetric, going to gynecological health. And that is what we call the universal health coverage, meaning that you are not leaving any person behind. We move together in accessing quality and affordable healthcare. So in conclusion, the ECSA Health Community's participation in these events were very successful. And as of now, we have already drawn the action plan on how are we going to implement resolutions that came out of all these events which we have participated. Together with our partners, together with our member states, under the leadership of Honorable Ministers of Health, permanent secretaries, technical experts, we are sure coming next year around this time, we will be somewhere in our journey to improving the health outcomes and well-being in the people of ECSA region and beyond. So let me take this opportunity to sincerely thank all the member states, all our esteemed partners, all the permanent missions who are in New York, who in one way or another, they made our event successful. Our plea to them, let us work together in implementing all the resolutions that were made during UNGA, so that next year we should be able to gauge ourselves against what we have been able to achieve as part of the implementation post-UNGA. I thank you very much.